Part 2, the larynx and the pharynx. This part we just review the structures of pharynx and larynx in the systemic anatomy. This is the pharynx. It's a fundibular shape. It's divided into three parts by the soft palate and epiglottis. Nasal pharynx, oral pharynx, and laryngeal pharynx. And here there are some structures: tuber torus, pharyngeal opening of auditory tube, pharyngeal recess, piriform recess, palatine torso. Larynx is composed of some cartilage. First largest, the thyroid cartilage, cricoid cartilage, epiglottic cartilage, and two arytenoid cartilages. This is anterior view, here is the posterior view. And between this cartilage, there are some joints. For example, here, this is a cricothyroid joint. This one, cricoarytenoid joint. And some membrane. Here is the thyroid hyoid membrane. Here is the median cricothyroid ligament. This arytenoid, that side, connect to, here is one, is a vocal fold. Here is from the coronary section of the larynx. Then its cavity is here. Thyroid cartilage, cricocartilage, the thyroid gland. This one is a inner view. This part is the anterior part. This cavity is divided into these three parts. Look at three parts. Vestibular fold, vocal fold. Between above this fold, now this part is the first laryngeal vestibule. Between these two folds, intermediate cavity of larynx. Below this vocal fold, infraglottic cavity. This time is to dissect the pharynx and larynx. The pharynx, including the nasal pharynx, oral pharynx, and laryngeal pharynx. The external feature of larynx. Superior laryngeal nerve, two branches, internal branch and external branch. Recurrent laryngeal nerve and its branches. This is the whole length of the pharynx. The lower part is esophagus. The pharynx is from the base of skull, then to the lower border of C6, here, C6. Now this is C2, C1, C2, 3, 4, 5, 6, lower border of C6. Downward is the esophagus. Now here is a space, a retropharyngeal space, very loose. This wall is the posterior wall of the pharynx. This is from the posterior view. Upper insert to the base of skull. Lower is continuous to the esophagus. In front of it here is a trachea. Upper part of the pharynx is the membrane, very dense membrane. And these are some skeletal muscles of the pharynx. Upper, middle, and the lower, they are contracting muscles. And they are arranged overlap. two side muscles fuse together in the median line. Here is from stylo process, stylopharyngeal muscle. This is a soft palate. This is the epiglottis. From these two structures, they divided this pharynx into three parts. Nasopharynx, oropharynx, laryngeal pharynx. Above this border is nasal, between them oral, below it is laryngeal pharynx. Middle nasal concha, inferior nasal concha. About 1 centimeter behind the inferior nasal concha, we can see this opening. This is the pharyngeal opening of auditory tube. Here is a tubular torus. Pharyngeal recess. Now maybe some cancer of the nasal pharynx happen here. This is the root of the tongue. Epiglottis, between the root and epiglottis, look at this is a deep fossa. This one is epiglottic radicular. This is an arch. This arch is pharyngeal glossal arch. And this one is a palatine glossal arch, palatine pharyngeal arch. Between these two arches, look at this fossa. And this fossa is a palatine tonsil. Beside the epiglottis, there's a deep fossa. This is a pisiform recess. Pisiform recess belongs to the laryngeal pharynx. Thyroid cartilage, the arch of cricoid cartilage, the lamina of cricoid cartilage. Now here there's a opening editor's larynges. Vestibular fold, vocal fold. And this laryngeal cavity is divided into three parts. This upper part is laryngeal vestibule. Above this vestibule fold. Between these two folds, this part is the intermediate cavity of larynx. Below the vocal fold is the third part. This part is the infraglottic cavity. So this is the three parts of the larynx. First, second, and third. From the posterior opening of the nasal cavity, you can see this pharynx can enter the nasal cavity. This oropharynx can enter the oral cavity from this pharyngeal isthmus. Then from the editor's larynges, it can communicate with the larynx. In front of this larynx, you can see here, downward is the trachea. In front of them, there are some infrahyoid muscles. Now cut these infrahyoid muscles. There's no a sternothyroid, and omohyoid. This common carotid artery. Now cut this superior laryngeal nerve and superior artery, thyroid artery. Inferior thyroid artery, recurrent laryngeal nerve, shear of thumb. Now, here is the behind edge. We will cut from upper suprahyoid muscles to damage the epiglottis. Then lower, cut this trachea. And esophagus. So put this larynx and the pharynx together away. Okay, this is the specimen of the cartilage, the thyroid cartilage. Here is the superior notch of the thyroid cartilage. This is the laryngeal prominence. Coracal cartilage. Here is the arch of coracal cartilage. Epiglottic cartilage, hyoid bone. Between the hyoid bone and the thyroid cartilage, there is a thyrohyoid membrane. Thyrohyoid membrane connect them. Now, between the thyroid cartilage and coracal cartilage, there is a coracal thyroid ligament. Connect them. Then turn it laterally. This is the superior horn. This is the posterior horn of the thyroid cartilage. Here there's a joint, it's coracal thyroid joint. Now posteriorly, this one is the lamina of the coracal cartilage. Here is the arytenoid cartilage. This is the muscular process. Muscular process connect the muscles. Here is a joint, coracal arytenoid joint. Epiglottic cartilage. From the upper view, vocal ligament. Vocal ligament. It connects from the inner surface of the thyroid cartilage, then to the vocal process of arytenoid cartilage. Okay, here this fissure is very narrow. This one is fissure of glottis. Between the coracal cartilage and the first tracheal ring, now here is a coracal tracheal ligament. From laterally, the superior thyroid artery supplies the upper pole of the thyroid gland. This branch is the superior laryngeal branch. Pierces membrane is the thyroid hyoid membrane into the laryngeal cavity. Accompanied with this nerve, internal branch of superior laryngeal nerve, both pierces membrane. External branch distributed to this muscle, cricothyroides. Now remove the thyroid gland. Here is a suspensory ligament of the thyroid gland. Recurrent laryngeal nerve is between the trachea and esophagus. Here is a sulcus. Goes upward into the muscles. Now clean the small muscles of the larynx. This is the cricothyroid joint. Here is the posterior wall of the larynx, shear of 8. Posterior wall of the pharynx. Open this wall. Epiglottis. Now this is the posterior wall of larynx. Epiglottis. Together, this is editor's larynges. This opening. Inside is the laryngeal cavity. Now, this is the internal branch of the superior laryngeal nerve. You can see here there's a fold, mucosal fold. If we open it, this is a branch of this nerve. This internal branch pierces that membrane, then enter the cavity of the pharynx. Then the branch is distributed to the upper part of the laryngeal cavity, above the vocal fold. And these branches go to the pharynx. This is the recurrent laryngeal nerve. This is branches of recurrent laryngeal nerve. It distributed the most muscles of the larynx. It also the communicating branch with this internal branch. Now open this cricoid lamina. Inside this is laryngeal cavity, upper vestibular fold, lower vocal fold. This fissure is ramar vestibular. This is fissure of glottis. Fissure of glottis is the narrowest part of all of the laryngeal cavity. So upper part is the laryngeal vestibular. Middle part is intermediate cavity of larynx. Lower part is infraglottic cavity. Here is the ventricle of larynx, ventricle, between these two folds. Okay, the summary. The respiratory tract, the air from the nose or nasal cavity into the nasopharynx, oropharynx, laryngopharynx, then larynx, trachea, bronchus. The digestive tract from the oral cavity, oropharynx, laryngopharynx, esophagus. When deglutition happens, this epiglottis backward close this opening, closes editus laryngeus. Okay, it's over this class.